what you probably have at home for little boo boo. You hurt yourself, cut yourself with like a knife while making food. You probably have a basic bandage around you. Now, the quick clot is exactly not what it is. It's usually for a a bloody wound that doesn't have a big size necessarily. It is silica balls that help absorb blood and prevent blood from continuing to flow. So it helps coagulating the blood to stop a bleeding. However, it is not a bandage, so you can't keep that on somebody because now blood, the blood that's on there, could get bacterias, and then the whatchamacallit, the wound itself is not going to be clean of that. It's not going to be separated from the elements essentially. So you have that danger. Um, Now the elastic bandage is just a nice bandage that's elastic pretty much. It's easy to apply to big wounds um, because it is elastic. Usually head wounds, you'll be able to use elastic bandage, the one that's going to be the most effective for any head wounds. I will give you a thing here in a second. So it is in, I'll put it in one section. Boom. So this is the medical technician course. If you scroll down to bandages and their effectiveness chart, you'll find um, a a list of failed dressings, packing, and elastic and quick clots as well. You'll find how well they work on each. As you can see, one that seems to have the best balance at working efficiently is the quick clot. However, it has some drawbacks, and we'll go over some of that. But yeah, you can already go down to the field dressings. That bandage, it's 3.1. You guys all see that?
Yeah.
Awesome. All right. So you can read some of it. Field dressings is usually you can use it for just about anything. Now, because we use ACE Advanced Medical System, the basic bandage itself is not necessarily used that much because the basic bandage for the basic medical system just acts as a general bandage. So if you have basic bandage in your kit, they'll work. It's just not the most effective because we use the advanced thing. This is why I recommend that you have 5 field dressings, 5 elastic bandages, and 5 quick clots for your personal infantry first aid kit.
So the
As
basic
well as
bandages are like jack of all trades, master of none.
exactly, yeah, they'll work, but they won't be the best for a lot of cases. All right, packing bandages. That's usually the big ass one. The packing bandages, yo, it's absolutely massive. This is usually what you'll use on bigger wounds. Um, it's most effective on velocity wounds, puncture, and avulsion. You've probably seen avulsion quite a bit. Every time we get shot, most of the time it's an avulsion wound, either medium or large. Now, in our current state of the ACE medical system, we have fatal wounds set to never. So if you shoot somebody, I mean, if you get shot, you will never die. You'll go unconscious, but you'll never die. So one of the main reasons you'll go unconscious and get shot after going unconscious is because of a bullet shot. So most of the time, the common issue that we're gonna have to deal with is avulsion wounds. So packing bandages are extremely good for avulsion wounds. Um, so yeah, that's that. They're the most effective bandage. Packing and elastics are very good. Um, the elastic bandages, good for contusions, crushes, and avulsions again. So yeah, that's that. And the quick clot, again, like I said, it's kind of like it's half a bandage and half a this and that. Um, you would usually use it first to stop it bleeding, but it won't keep it from reopening that well. You can use some other more fitting bandages to help sustain the chance of reopening. So abrasions, we don't have that anymore because we're not using all of the 10 medical mods that we used to. So that won't happen as much as it used to. Avulsions will occur when an entire structure or part of it is forcibly pulled away, such as a loss of a permanent tooth or an earlobe. Sources: explosions, vehicle crashes, grenades, artillery shells, bullets, backblast, 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 falling.
Chan.
Effects: severe bleeding and high amounts of pain, depending on the size of the avulsion. Pretty much backblast will cause anything except like crush wounds, really. Um, Now, contusions, also known as bruises, these are the result of a forceful trauma that injures an internal structure without breaking the skin. Bullets, backblast, vehicle crashes, falling, effects no bleeding, minor pain. Uh, if you're still alive but you see your screen go into pain mode, most likely have a contusion or some sort of minor or medium wounds like this. It's not fun, but at least you're still in the fight. Crush wounds, we don't have much with that anymore. Cut wounds, cut. Just again, like this is usually not that big of a problem. If you get a cut wound, you're probably still conscious, so you're good. And then velocity wounds, which is another one that will happen a lot. Velocity and avulsions are the most common when dealing with bullets hitting you, pretty much. Velocity wounds, these are caused by an object entering the body at a high speed, typically a bullet or small pieces of shrapnel. So again, sources: bullet, explosions, grenades, artillery shells. Effects: medium to high bleeding and severe pain. Alright, so now that you know pretty much like the basics, the basic wounds that we're going to be dealing with, and you know the basic bandages that we're working with, we're going to go over the usual, um, how do you say this, the way that you do it, the step-by-step guide pretty much.
Quick question before.
So yeah, you have a question?
If you go on the chart, elastic bandages is like on top of every other bandages
For yeah, for
for like everything.
pretty much everything, yeah.
Okay.
I am not sure if that is the most updated because I remember seeing one where it was slightly different. I'll try to look for the most updated thing.
This one
Uh,
says 3.7.0.
yeah, I don't know
Because
where we're
in
at.
that case, I would just bandage with the elastic in any
Yeah, but at the
scenario.
same time, like the reopening chance is not the
Okay, yeah.
greatest in some of them.
Okay, yeah.
It looks about the same with the packing bandage, so
Yeah, it seems more efficient than I'm just looking at it again. Yeah, it seems more efficient than elastic, than packing. Sorry, and then it has the same, yeah, same
Same
reopening
reopening,
chance.
but a better
Yeah.
efficiency.
Well, that's why I said field dressings, elastics, and quick clots. I don't have packings in my kit,
Yeah, me neither.
but yeah. So that chart is pretty good to have handy to figure out what's good. All right. Other pieces of equipment that we have is the tourniquet. So the tourniquet is usually to stop a bleeding. However, it also stops the blood flow. So if you keep it too long, you might pass out from a lot of shit, and you might lose your arm or leg or whatever. Obviously, you can't apply. I'm glad you can't apply it by design, but you also can like it would be stupid to put a tourniquet on your head because then you would definitely die.
Like Twombly said, just choke him.
Yeah, just choke him exactly. If he has a wound in the head, just choke him. Just go behind him, get him like in a Brazilian choke, and chop. Keep it
Hold it
tight.
there while the medic works on him.
Exactly. And then we have the splint. The splints are usually used to support and stabilize limb injuries. So uh, if somebody is limping or somebody has fucked up arms, fractures, um, just slap a splint on it, and you should be back in the fight. In the future, that will be a little different. It's not gonna get you back all the way exactly. Right now, I have it so it like literally fixes it, but it shouldn't be a thing. It should only support it in the meantime until you get proper medical attention. Um, Then we have auto injectors. We have morphine, epinephrine, and adenosine, sorry. And we have atropine. Atropine now we don't have anymore. Um, it might come back soon because I'm looking into a mod that handles CBRN stuff. So we might
Is it
have to
chemical
use.
warfare?
Yeah,
Doesn't that only add nerve gas and like another gas? I forgot. Hold up.
yeah, but because of that, I might find the add-on to Ace Medical that allows us to use atropine, because atropine is like kind of the quick repellent, or it fixes your shit pretty much for whenever you've been hit by uh, NBC stuff. So morphine will suppress pain. Um, it will suppress a lot of pain. So if you have a little bit of pain, it's like if it says like little pain, or I can't remember what it says, but don't even use morphine at all. Let it go. It's gonna go within 5 to 10 minutes. It's gonna disappear. It's better than giving you morphine, because if you give morphine, what's gonna happen is
5 seconds
morphine will
later,
also decrease blood viscosity and will make the pulse and blood pressure drop if not used properly. So that just means that if you're running at the same time you're in high intensity after just shooting yourself with morphine, you might just pass out from the your shitty blood flow, and heart rate.
couldn't be me.
It is a very very strong drug. If any one of you has ever been on morphine, can probably tell. But yeah, you're not supposed to be able to fight after having a morphine in you. Epinephrine is quite the exact opposite. It's used to increase the patient's heart rate and assist with them regaining consciousness. And it can treat morphine overdose. So if somebody's been passed out from morphine, just snap epinephrine in them, and then that's going to help counter the effects of morphine. Now we have another thing that's pretty cool is adenosine. It lowers the heart rate, but it doesn't act as a painkiller. Okay? So um, if you're treating somebody and for some odd reason you gave them epinephrine before, and they had lost a lot of blood, so you give them morphine and it acts on a little bit of blood, it is possible that the person goes into like fucking Red Bull overdose and their heart is pumping, 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 and that's no bueno. So using adenosine, you'll be able to chill them down a little bit, without having any crazy side effects to it, such as morphine does. So that's that. We do not have any other piece of equipment other than surgical kits and all that, but that becomes over the TCCC qualification. That's straight up medical stuff. So we will just go over the basic first aid stuff, emergency first aid. So first thing first, the treatment protocol. So what do you think? Well, you probably have it in front of you, but what do you think is the first step?
Checking a pulse.
Well,
Depends
The
if he's
first step
conscious.
would be looking at their medical menu and seeing what's the problem.
yeah. So the easiest thing to do is just when you walk up to somebody is the patient responsive? Is he conscious or unconscious? Um, what that means is if somebody's unconscious, you're gonna have to go and treat them. If they're conscious, you can help them. You can help them treat themselves, but they probably have already diagnosed their own issue. Usually in the real world, when you pull up to somebody, you'll usually say your name, and then you'll
Hello, I'm
start
Philip.
patting.
I'm the first aider.
Yeah, exactly. Yeah, legit. No, I'm not kidding. This is literally how we're trained. And then you're gonna start patting them down, looking for the injury. Usually, if the person is conscious before patting them down, or while patting them down, you ask where they're hurt or where it hurts, or you're trying to figure out as fast as possible. So if the person is conscious, they can help you figure it out. So if the patient is responsive, get them to move to your location or hard cover. If the person got hit in the middle of the field or whatever, you don't want to help them in the middle of the field. So if the patient is responsive, you get them to move to you or to a piece of cover that you can then move to. Or if the patient is not responsive, then you'll continue the firefight until um, you've reached fire superiority or the enemy contact has been properly killed. So once you've been able to protect yourself in either or of the ways, you can now move to their location. You can either treat them there or move them, drag them or carry them to a better location. So is the patient wounded? So if yes, always go for the bigger issues. So what you want to do is stabilize people ASAP. Um, put a tourniquet on wherever he's bleeding. Slap a bandage on smaller cuts, smaller bleeds, but make sure that person is stable ASAP. I would even recommend you stabilize somebody blood-wise before moving them or before wasting any more time on anything else. Now there's these steps that we can skip because we don't have these mods anymore. Boom boom. As the patient lost a lot of blood, if yes, you can start IV treatment. That's more for the medics to do. As a first aider, what you want to do is make sure the person is stabilized, and if a medic is in the vicinity or able to come and treat, you will not need to use your morphine or epinephrine. Even for yourself, there's absolutely nothing I can do to prevent you from doing it, but I strongly recommend that you never use morphine or epinephrine on yourself or on anyone else without the approval of a medic, or unless obviously unless you're in what we call the emergency first aid scenario, where even the medic is not available. In this case, feel free to try something, um, obviously within safe parameters. But first step is obviously making sure the area is covered or there's no enemies so you can treat. Then moving to that person, treating them, stabilizing. So stopping every bleeding areas as fast as possible, and then CPR until a medic arrives. Usually, what you want to do is if the person has lost a lot of blood, they'll be quite unstable. You patch them up. You do CPR while while you wait for the medic. The medic will give blood, allowing for any other medicinal ingredients to work properly, such as epinephrine to wake them up, and then that'll be it's close pretty much. So yeah, so none of us will be able to pretty much give IVs on the field except the medics, and that's that. And now you have the knowledge on which bandages work better for different kinds of issues. So now we're gonna go shoot somebody and then treat them, pretty much. We're going